Hello, hello. We'll get started in another 5 minutes. Hello, everyone. We'll be starting in another couple of minutes. Okay. Thank you, everyone, for joining us tonight. I'm going to get started because I value your time. And for those people who join us late, the recording will be available. And so that should be of assistance. Basically, our template for tonight is that I'm just going to do a brief 30-minute presentation and then we'll open it up for you guys to ask whatever questions that you may want to ask. In the meantime, during the presentation, I encourage you to be able to put your questions into the chat, because sometimes, we try to remember and we just lose track of what we were thinking of. So as soon as a question comes to you, as soon as a thought comes to you, just be sure to just slap that bad boy into the chat. And that way, that we will definitely address any questions, thoughts, concerns as we wrap things up in terms of the formal presentation, and we open it up to question and answers at the end. All righty. Is that good for everyone? Say yay in the chat. Okay. All righty. Thank you, Danielle. There's a yay. At least one person is listening. All right. Okay. So let me do this. And welcome, everyone. Tonight, today, good morning, good afternoon, good evening, wherever you are, as you are listening to this presentation. I thank you for choosing to prioritize your health and well-being. As you know, we are living in the middle of a significant healthcare crisis. Today, we're going to talk about your path to affordable and most effective healthcare, true healthcare, as opposed to what we have in our nation today, which is what I refer to as simply a disease management program. Unfortunately, even with all of the advancements that we have had in our world with regards to health and well-being, 68% of medical bankruptcies happen to people with insurance. Now, I recognize that there are some of you that are with us today, that don't have insurance, because the reality is that 40% of the people in our nation are functionally uninsured. But even those who are insured end up having bankruptcies due to medical debt. In fact, 62% of Americans with high deductible, high premium insurance, they skip and delay care. The average family premium is around $22,000 a year, and medical debt impacts more than 100 million Americans. An individual is looking at about $1,650 per year per person, and 40% of Americans cannot afford not even a $400 emergency. We've seen a significant increase in premiums, over 230%. But guess what? Wages have only increased 68%. And it's even beyond inflation, which is about 47%. But even more important to me, the reason why I have struggled over the years to figure out how can I help people is not just simply about the mathematics of the money. A couple of years ago, I got a call over the weekend. It was on a Sunday. Someone that I had worked with prior, he had come to me and he wanted me to just give him some insights into what was going on with him. And I gave him certain warnings because I saw certain things in the assessment that I had done with him. And he'd put it off because he said, you know what? I can't afford it, Michelle. And that weekend, he called me from the hospital. They had admitted him to the hospital because his blood glucose level was over 500. And he stayed in that hospital for about 2 or 3 days. And when he left that hospital, he had a bill that was over $10,000, a bag of prescriptions that he couldn't afford to continue with. And he was no further empowered in terms of knowing what to do to improve his health. The reality is that 29% of the people who have prescriptions are skipping their medications, many of them because they can't afford it. And some of them because they've come to the realization that the medications are just a Band-Aid and they're not doing anything to resolve the underlying issues. And as I related to you in this story of this particular gentleman, and I wish I could tell you that he was an anomaly, but unfortunately, I get a lot of those calls with people that I've spoken to and I've warned about different things that I can see in their assessments, and they kind of put it off and say, oh, Michelle, I can't afford it, can't do it, can't do it. Delaying needed care. 43% of people delay needed care. And 51% of Americans have their savings drained to deal with medical bills, similar to that gentleman that I was talking to you about. In fact, the $10,000 bill was way beyond what he had in savings. I'm not even sure if he's been able to pay it off at this point in time. And so the other thing that I deal with, that I see a lot, is that people come to me because they say, you know what, I don't trust the healthcare system. I don't trust my doctor. And they've had bad experiences in the past where they go in and after waiting for a month, maybe for an appointment, they go into the appointment and at most the person spends maybe 10, 15 minutes with them and just simply gives them a bag of pills, or prescription rather. And so they've had bad experiences, and you probably can relate to this, where you go in and you don't feel that you're being heard. Sometimes they'll even do a lab work, and then they'll say, oh, nothing's wrong, you're okay. And you're looking at the person like, wait a minute, I would not have come here if I was okay. There is something wrong. And so 68% of people report that they have communication issues with their providers. Summarily, we're dealing with what I refer to as a triple threat. On one hand, there's a significant cost to the current healthcare model, and it just keeps going up and up. Ironically, as Americans, we spend more on healthcare than any other nation in the world, and our health outcomes are amongst the worst. In addition to that, we are dealing with a significant crisis of chronic illness. Over 60% of Americans have at least one chronic condition, and 40% have multiple chronic conditions. So it's not like people are just dealing with one chronic issue. In fact, as I said, when people come to me, they're pretty far gone a lot of times. And they're dealing with things like not just diabetes, but diabetes in addition to hypertension, in addition to digestive issues, in addition to autoimmune issues, in addition to, chronic infections, fatigue, in addition to depression, anxiety, or some other mental health concern. And then the third part of this is that in light of the fact that we're paying more money and we're having worse outcomes, we've gotten to the point where we do not trust our healthcare system. We basically see them as just robber barons. And in our minds, we're thinking, okay, how much is this going to cost? Am I going to have to mortgage the house? So summarily, when we look at how money is spent in the current paradigm, about 15 to 25% is just administrative costs. And then, of course, it's a business, so there is a profit margin of about 15 to 20%. And only about 60 to 70%, if you're lucky, goes to actual care. And again, remember what I said, that care is really just about as Robert F. Kennedy Jr. said, shuffling the decks on the Titanic. Because really and truly, it's a misnomer to call our current medical system healthcare. It's just like life insurance is actually death insurance. So our current healthcare model is actually just disease care or disease maintenance. Keep in mind that about 30 million Americans are dealing with some type of cardiovascular disease. Almost 40 million Americans are dealing with diabetes. Over 40 million Americans are dealing with obesity. In fact, the latest statistics are that 70% of Americans are either overweight or obese. And this has led to a expenditure of over $730 billion annually on preventable disease costs. And that's a conservative estimate. In fact, most estimates that I'm looking at these days are saying that our disease costs as it pertains to chronic illness is actually trillions of dollars. And there are systemic issues. The average appointment time, as I said to you before, if you're lucky, is about 17 minutes. And insurance companies, they drive me crazy because they deny the craziest things. I have people coming to me dealing with blood glucose issues, and I say, you know what? We need to do an insulin test. And would you believe that a lot of these people who go back to their medical providers, the medical providers say, no, the insurance company won't cover it. And I'm thinking to myself, this is freaking insane. This is critical information that we could use to prevent diabetes. And even if you do get something authorized, it is after spending days trying to get that authorization. So that is why I've gotten to the point where I say to people, you know what? We are going to create a new model. I don't know about you, but I am sick and tired of being in a system that does not help people to actually heal, does not help people to actually get better. And I'm also sick and tired of the flip side of that, which is quote unquote functional medicine, which is so high in cost that most people can't afford a functional medicine provider. And that is what I have struggled with for over 20 years. I love working with people, absolutely love working with people. And I prayed to God, I was like, please, 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 please show me how I can provide assistance and support to people without having them mortgage their house. And that is why I'm so excited to share this new model with you today. It is a completely revolutionary approach to healthcare. And when I say healthcare, I mean actual healthcare, customized, accessible resources and education. A model that is value-based, a model that will give you access to care the same day, or at the very latest, the next day. A model that is focused primarily on allocating the resources to prevention and restoration, and a model that leads us to have a patient satisfaction of over 87%. And the reason why we have that high level of satisfaction is because we are focusing on chronic illnesses, reducing chronic illnesses. We're also focusing on helping you to be actually healthier. And that leads to, guess what? Reduction in sick days, reduction in healthcare costs, reduction in claims if you actually have a health insurance plan in addition to the healthcare plan that we provide. And the beautiful thing is that you have access to 24/7 virtual care with a response time that is less than a minute. You have same day availability for appointments. And that's, like I said, that's what leads to an increase in satisfaction. And the best part about it is that it leads to us having an ongoing relationship for many, many years. And so we have the possibility of continuity of care, which is more than 90%. So let's talk about these solutions that I'm referring to. It is a membership-based concept where you have the option of 3 different levels of membership. Different levels of membership provide you with different degrees of support. So the first level is what we call foundation. And the foundations level are where we have services that are common to all the different membership plans. That's why we call it the foundation plan. And this plan at this level is basically for your do-it-yourselfers. There are a lot of you that don't need a lot of support, but would like to have guidance and would like to have access to education and training, would like to have access to emergency care, that just in case kind of scenario. And so that is what the foundation plan provides. It gives you unlimited, yes, I said unlimited, instant telemedicine with prescription drug discounts. Now, I recognize that most of you that are listening to this presentation probably say, Michelle, I don't need medication. But you know what? My mama told me that there's a time and a place for everything under the sun. And so I want to make sure that you're covered. Just in case something happens at 2 o'clock in the morning, do not call Michelle. Let me tell you that, because Michelle does not deal with acute care. So whenever there is an urgent care issue, I want to make sure that you are covered. And so what I have found is the ability to provide you with 24/7 instant telemedicine, where you can open up your app, log in, and have someone address your concerns in less than a minute. This in combination with, at the beginning of your membership and every annual renewal, you'll get access to a comprehensive disease risk assessment report. When you get that report, you have the option of doing a case review with one of our foundational healthcare providers. Either at the time of this recording, it is either Dr. Tom Lewis or myself. As our community grows, we will be onboarding additional practitioners to help us out with this. In addition to that, you have the option of adding on what I refer to as what if essential benefits. And these essential benefits include things like access to behavioral therapy, because some of us need that additional support. It also gives access to things like paying for your labs, access to free medications. Maybe you are on a prescription medication at this time. You can check the list to see if your prescription medication is on that list. In addition to that, it gives you free monthly Q&A with us, with our doctors, what we call the Doctors Are In, where you are able to send in a question or put the question into the chat for a specific health concern that you have. You'll also be able to be a part of our monthly advanced study classes, where we do a book study. Each month, I choose a book and we read that book together as a community, and we learn together as a community. I have to tell you, as a teacher, I'm always in the process of learning, always in the process of up-leveling my understanding. And I want you guys to join me in that particular adventure. You also have access to what we refer to as the ABC clinics, Assess, Build, Cleanse, because you will have access to our online learning center, where you will have courses such as Health Detective, Eat to Love, Revitalize You, Heart Song, Seasonal Cleanse. All of these courses help you to deal with different aspects of the healing journey. Health Detective is the course that talks to you about doing different assessments learning how to read your lab report and understand what your lab report is. So you will have the ability to order labs at a discounted rate, and you can get those results yourself, and then you can log in to the ABC clinic and ask questions pertaining to your lab. Because the beauty of what we are sharing with you today is that it is focused on empowering you, giving you the tools that you need to be able to take charge of your life. My goal is that everyone can just be at this maintenance level of foundation where they don't need me, they don't need our health stewards, they don't need Dr. Lewis, except for moments of extreme intensity. Now, the next level is what we call CHAMP, because it is a community health assurance mentorship. At this level, in addition to all of the benefits of the foundational level, you also have access to group support, a bi-weekly coaching sessions. Now, these coaching session groups are based on the results of your health risk assessment. So depending on what was flagged in your risk assessment, that will determine what groups we invite you to. So once we've looked at what you have reported to us in the health risk assessment, we can say to you, you know what, Johnny? You have significant risk factors for blood glucose regulation. So we would suggest that you join the group that deals with that particular issue. Or perhaps when we look at your health risk assessment, we see that you are dealing with a lot of immune issues, or a lot of hormonal issues, or a lot of digestive issues. So you will be invited to join a group that deals with a particular issue that is specifically of concern for you. In addition to that, you will have access to our app. In this app, you are able to talk, message your health steward, the person who is in charge of your group, your mentor, 24/7. You can send in those messages and they will respond to you within 24 hours. In addition to that, you're able to gain access to customized meal plans as it pertains to whatever specific health issue you're dealing with. In addition to that, you have access to exercise plans, meditation plans. You also have the ability to track different things. So if we find out that you're dealing with blood glucose issues, you have the ability to track your blood glucose numbers, and your health steward can see what those numbers are to be able to give you additional support with the issues that you're dealing with. In addition to that, meaning the health app, you also have access to our monthly Things to Know webinars. That's when we do a deep dive on a particular topic that we have been researching. Some of you are familiar with Dr. Tom Lewis, and you know how he loves to geek out on different things. And I myself love to geek out on different things. And so this is where we will have monthly webinars on a particular topic that we have done significant research on, and we want to present those findings to you. In addition to that, you'll have access to our monthly fireside chats, which are more laid back, more personal and things of that nature, and our body mastery sessions with our body mastery guy, Stan, who is phenomenal when it comes to helping people who are dealing with various issues that pertain to musculoskeletal issues. So joints and pains and, physical things of that nature. Last but not least, you'll have access to a member-only community with exclusive content. And of course, you'll have access, as I said before, to discounted pricing on labs. And when I say discounted, I mean the price that I pay will be the price that you pay, because we have worked it out where you'll be able to pay the lab directly. So there's no upcharge. There's no Michelle trying to get a little cut on anything. You will get the actual cash price for the labs. So for instance, something like insulin, a test for insulin, if you were to get it through the insurance paradigm, it would cost significant amount of money. But through this paradigm, an insulin test, and we always do it in conjunction with blood glucose and also A1C, it's less than $25. And then you also get access to various member rewards and preferred pricing on supplements and retreats. Last but not least, the third level of membership is what we refer to as Tree of Life. And Tree of Life is where we get individual mentorship in addition to the group membership and in addition to all of the benefits of the foundational plan. So what does that look like? It looks like you will have one-on-one private sessions on a monthly basis with your health steward and a semi-annual consult with the provider of your choice. At the beginning of your membership, you'll get to choose which provider you would like to work with. And so once that is done, at the semi-annual point, you'll be able to get your semi-annual checkup, in a way of speaking, where we would check in with you and see what needs to be done. In addition to that, you're going to be able to, as I said, access the labs at a discounted rate, or if you have opted into one of the what if plans that include the free labs, then you're covered. Summarily, the three plans are as follows. At the foundation level, it's $59 per person per month. At the champ level, with the group support and access to the app and the community and all of those resources, it's $109 a month per person. And at the more accelerated support level, the Tree of Life support level, it's $209 a month. I'm encouraging you to really think about how you want to do something different with your life. The fact that you are here, as I said before, tells me that you recognize that triple threat that I spoke about, that triple threat of rising healthcare costs. And in actuality, like I said, it's not even healthcare, it's just disease management, because nobody's ever getting off of medications on these plans or getting better. They're just slapping on a Band-Aid, a pill, powder, potion procedure to just hopefully get you to not fall apart. The second thing is that, as you know, it's not dealing with the root causes. It's not dealing with the chronic situations that underlie and unravel most of us. It's not giving us the true care that we need and deserve. And last but not least, how many of us actually trust the system at this point? So I invite you to enroll in one of our membership plans. And if you're not yet ready to enroll, if you still want to have more conversation, you can either scan this code or click on the link below, and you'll be able to go to a website where all of the different plan benefits and details are listed extensively on this page, as well as the recording of this presentation. And you will have the ability to also click on the link to book a clarity call, to have a conversation, to discuss any questions or concerns that you may have. Now, I want you to keep in mind that this is a limited offer. And I'm not just saying that, because, and most of you on this call know me, I do not make idle comments, okay? The reason why I'm saying it's a limited offer is because we're just doing an enrollment for individual people for this month of February 2025, when this recording is being done. After this, we will do annual enrollments because our significant target has shifted, and we're going to be dealing primarily with small business owners who are dealing with their employees of 50 or less employees. But I wanted to make sure that I brought this offering to you. Many of you have been with me for years. Some of you I can see have been with me for almost 20 years, some of you that are here today. And so I wanted to make sure that I made this offer to you because I know some of you in the past have come to me with different concerns. And I didn't have a model that was affordable. And so now I can truly say that I am able to provide you with health care, customized, accessible, affordable resources and education. I look forward to working with you to improve your health and well-being. Okay, everyone. I'm going to stop recording.